So from my understanding, you've developed some pressure sores, right?
Yes.
Okay, so we have some occupational therapists here that are gonna come help you. Oh, sorry.
Yeah, it should be 6.
All right, I'm ready when you are.
Okay, so for case study 2, it's Alejandro is a 42-year-old woman from Honduras who's experiencing a hemorrhagic stroke 3 years ago, resulting in significant left side weakness. She received extensive rehabilitation but continues to face difficulties with mobility, transfers, and upright positioning in her wheelchair. Recently, she developed pressure sores on her buttocks, and staff have noticed that she frequently slides into a posterior pelvic tilt. She has limited range of motion in her knees, and while her left knee can achieve full extension with assistance, this asymmetry makes it difficult for her to maintain stability in her wheelchair, and she often requires help to prevent falls. And see.
What's that thing?
Alejandra, from my understanding, you've developed some pressure sores and some pain and discomfort.
Yes.
So we have some OTs here, occupational therapists that are going to come and help you with stabilization and repositioning to help hopefully resolve some of that pain and discomfort that you've been feeling.
Okay.
And so bottles of liquid. Thank you.
Hi Alejandro, my name is Caitlin. I'll be your OT today. Then I have a co-ed here, McKenna.
Hello.
So we'll be helping you. So we just want to do some assessments, just so we can make you feel a little more comfortable in your wheelchair, okay?
Okay.
Alright, so before we begin, first I want to place a gait belt on you. This is just for your safety, okay?
Okay.
Alright, does that feel okay?
Yeah.
So I'm gonna just place your hands in your lap, transfer over, lift that up. Alright. So I'm gonna just support you on your left side because I know you're experiencing some weakness, okay? So we're just gonna transfer over to the table together on the count of 3, okay? 1, 2, 3. Alright. So I'm gonna support you here and then we're going to the wheelchair just a little bit out of the way. Alright, and then let's place your hands here. Okay, sit there. So first I'm just gonna palpate your hips, okay? Is that alright? Alright. Okay, and then can you sit up as far as straight as you can for me? Okay. Alright. Get back and relax. Thank you. Next we're gonna have you lay down, okay? So I'm gonna have you lay down this way. I'm just gonna lower yourself slowly. Right. Okay, so we're gonna check for kyphosis, just with the posterior pelvic tilt and your head is touching the table. So next we're going to do some knee extension, okay? So we're gonna come over and help. Try to see if we'll lift your
So I'm gonna have you bring your knee up to so bend your knee. Yep. And then is this as far as you can move your knee?
Yes.
Okay. So we're doing like 65. And then down.
And we're gonna do right leg next. Alright, so I think that concludes the measurement. So we're gonna transfer back over the chair. We're gonna do some measurements while you're seated in your wheelchair, okay? Here, I'll let you move it for me. And then I'm gonna help you sit up, okay? So slowly, and then alright. And then I'm gonna have you transfer back over, okay? So we're just gonna go on the count of 3. 1, 2, 3. Great.
And then we're gonna look at your arm
Just some recommendations we had. We would insert a wedge cushion under with your posterior pelvic tilt. That will just help provide the support and limit any sliding out. And then we would also adjust the leg rest, since we know that your active range of motion is only 40 degrees, and usually if it's under 70, we don't want you sliding out of the chair. So you would adjust that in between, not so you're fully extended to your max, just so you're comfortable. And we also thought possibly just adding lateral support, since you have some left side weakness, just to help support you. Okay? Okay. All right. Thank you.
Same situation, your testing is great. We need to see, because if you're done and you're gonna walk away and you left them the way you found them, there was no solution. The rubric is expecting you to come up with the plan. So even if we don't have it, what could you have done for this person here and now? Like right now with what we have, the limited resources, what solution could you have provided now?
We would just actually like make sure we put the wedge cushion before we transfer them back.
Exactly,
Right? Okay. that's
exactly.
fine.
So if you were doing any kind of cushioning, which I would expect most of you would be, make sure that you do that before you walk away. So when you look at us to say, I'm done, don't be like, done.
Yeah.
Okay? Okay,
Okay.
so then that would be like, okay, we can help you in that moment.
Okay.
Would you recommend doing the wheelchair measurements before we even put them on this table?
So I put, because I didn't want to forget. So everything you did was correct, but I would measure all my stuff without my patient in there, put all my cushions in there. Then we go back into the wheelchair. And even if you wanted to measure the actual patient, you could do that while they're at the mat. So I would deal with the wheelchair, the cushioning, your solution, then you bring the individual back. Because that's just sequencing. It's not that you were wrong, but just the sequence of events. What if you put them there, you're like, okay, I need a cushion, then like, I don't want to get out. I don't want to get out of my chair, I'm tired. Then what did you just do, right? So just remember that. So just remember that sequencing, very important. Think it out, plan it out in your head, and then act it.
During the practical, is it okay to like leave the person to go get the stuff, or are we supposed to pretend that they are like, she's left-sided?
So I want that to be as real as possible.
Okay.
Yeah, so really plan what you're gonna do.
Mm-hmm.
If they're sitting like this and you're like, hey, I'll be right back.
Mm-hmm.
It's like, what? You're gonna
Yeah.
find them on the ground, right?
So if you like laid them down,
I
or
would lay
something?
my patient down. I think that's just a safety thing I would always do. I never walk away from a client unless they drove in by themselves. And I know that, oh yeah, they're gonna drive home. Yeah, I'll walk away. But if I found them in bed, they're in a wheelchair, don't do unnecessary things. Because they might think you said, let's go. And then they try to follow you. They didn't hear what you said, they didn't understand, or they took your visual cue of walking away like, oh, that's for me too. So there are all these things that can happen in this space, so I would always err on the side of safety. Or that's where your planning comes in. Plan your thing before you even show up. Everything you think, all your leg rest, everything is right there with you. So if you are reaching out, you're just reaching out. You're not needing to leave the room. Yeah.
So when we walk in, does it start as soon as we walk in, or do we get the chance to get everything?
So you're gonna walk in, let's say the two of you are the matching partners, you're gonna walk in, you pick your case, you're being tested, she's the patient, you pick up your case, you read it, you understand. If you need to highlight things, you can bring a notebook, you can bring a notepad to write things down, that's fine. Make sure your patient reads it, just like the FISDIS practicum, they read it, they understand, and everyone is gonna start in the wheelchair to cut out on time, wasting time. So if you're the patient, you're gonna get into the wheelchair and get into shape. And then you give us a cue that you're ready to start. Yeah. So make sure that you've agreed and you've an unspoken language like, okay, this is good, you're all set, I'm good to go. Okay, then after that, the patient, you just become the patient, you don't help. Just like what we did in the other class, you're just there and let them do their job. Even if you can see like, that's not it, you just be patient. Okay?
Similar to now, are we gonna just do it without the leg rest on?
If you want.
Similar to now, are we just gonna do it with the leg rest not on?
Yeah, so yes. I don't think anyone needs to have their leg rest on the case studies when you first come in, but they'll be in the wheelchair. But if leg rest is a solution, then you wanna have your solution in
Sure.
place. Yep.
I have two questions.
Yes.
First, for the measurements, are we allowed to write them down so that we can use them for the software?
Yes, I want you to bring, like in real life, we don't walk into patients' rooms with nowhere to write. So have your whatever, I've had students bring their iPads, I'm fine with that, but I just think it becomes a little cumbersome to be like, what if it logs out and you need to go back in? I'll just bring a notebook or something, some way to write things down. Because when you do your SOAP note is an actual representation of what happened. So if you say out loud 16 and I wrote 16 and then your SOAP note says 12, I might question you like, that's not what you say, because I'll be writing things down as well. Okay, because I want you to be ethical. You document exactly what happened, that is exactly what is on your paperwork as well.
Also for, like, do we have to say and fix all the solutions, or you like split the cushion, for example, and then you just say add the leg rest, or you also add the leg rest in the cushion?
So, very good question. I'm gonna go through that at the end. When we do our evaluation, you do an occupational therapy evaluation, you assess everything, all your testing, right? That's our eval. When it comes to solving the problem, we can't solve everything in an hour. We don't have time for that. So the critical thinking skill here is, what is the very most important thing here and now? If your patient is sliding and you leave them without a leg rest, you see what I'm saying? So you need to think about my patient. Yeah, I think I can put them in an anti-thrust cushion, but I heard that they just fell and took a really bad fall forward, and I leave them with their feet hanging. That's not good clinical decision making. Okay? So really think through. So it looks so straightforward, but think through. What am I gonna fix here and now, and why? And why is that the most important thing that I need to fix now? Make sense? Any other questions? So when you say cut, I'm done, we should see someone, I should be able to look and say, oh, okay, this person was falling out of the wheelchair, could they fall out again? That's our question. Okay?